Dr. Ajit Mulasri, welcome to Medanta Cardiology Conclave. It's our first international cardiology conclave, which we are organizing on the behalf of Medanta Patna. So, first of all, we welcome you here first time for such a meeting. You have been here as an examiner earlier and for inspection of DNB courses. So you were speaking on use of artificial intelligence because day by day the cardiology, interventional cardiology has developed. It has developed from angiography to simple angioplasty, then stent angioplasty, then drug-coated balloon, and then imaging. And now it has come to integration of artificial intelligence with imaging. So what's your take?
It's a very important part of today's today's technology, and we have to understand that artificial intelligence is going to change all that we do, and especially so in an image or in a picture. It has replaced most of, as you know, X-ray, pathology, ECG. Artificial intelligence is now showing superiority over routine cardiologists or pathologists or radiologists reading these pictures. And the reason is because your eye can see only that much in a few frames, however you are well trained or equipped. So the machine learning followed by deep learning and artificial intelligence is going to replace most of this, but subject to obviously a physician's interpretation of what those tests are. Because it's not going to replace a physician, but a physician should know exactly what artificial intelligence is providing you today. The second story which I look for in intracoronary imaging is the simplicity. As we know, intravascular ultrasound and FCT was dependent on the operator experience. And operators could have various experiences, and therefore a person who's just getting initiated to OCT or intravascular imaging may confuse the diagnosis, may not see the calcium as well, may not know where is the EEL or the depth of the artery or many of the complex situations which requires a lot of experience. What artificial intelligence has done is captured more than, at least for OCT, around 10,000 pictures and read it through a deep learning system and provided now as a simple tool to at least show calcium very clearly on an OCT. And same is true for intravascular ultrasound. I've been fortunate because I've been working with artificial intelligence in intracoronary imaging for the last 5 years, and we are now, part of a global study to use artificial intelligence to look at many of these imaging tools.
Yeah, Dr. Mulasri, basically he runs a core lab, the only core lab for interventional cardiology and cardiology in India, and he has published data for studies which are being conducted outside. So as per my knowledge, what artificial intelligence is like, basically it is an advanced human brain, what I can say. For human brain, if we feed multiple things, it can forget some of them, but the benefit with artificial intelligence is that it never forgets anything. It integrates every data which is fed to it. That's why it's an advanced human brain, what we can say.
Also, you have a traditional way of thinking all the time, which you have been taught and which you don't like to forget. While Shamshad may think one way, Ajit may think some way, somebody else may think some other way, but the machine has learned from everybody what it should be. So it removes your discrepancies, what you think is right, out of the way, and looks at the whole pool of data which is summated, taught to the machine, and interpreted by AI. And that helps you in a precise diagnosis. And I was just saying today that if we think that artificial intelligence is not going to affect medicine or cardiovascular science, I think it's crazy, because even for things like empathy, telling a patient that, or a relative, that he is no more. There's a study in oncology which says the machine is more empathic than the doctor in just giving bad news. So I know it looks funny that I don't want to tell a machine to tell me you've got a ST elevation MI. I would rather have a doctor or somebody else coming and saying to me. But end of the day, that's where the science is growing, and I think it's important for us to quickly understand what is the implications of this, and be tuned in and knowing what to do in this era of artificial intelligence.
Thanks a lot, sir. We hope that you must have enjoyed the scientific session. It is our first scientific session, and we hope to have you here.
Thank you so much, Shamshad, for calling me here. It's an excellent venue. It's a very nice place to be. I've been to Patna before, but and it's a very good conference, very excellent speakers and technology being shown here. I wish you success to this program and the future programs in the near years to come.
Thank you, sir. Thank you.
Thank you.